So why? Why do we give these various medications? Lots of reasons. The action of these vaccines and toxoids is to produce immunity in the body without actually making the person suffer the risks of the illnesses, which, in spite of what people say, do kill and maim a small number of the people that get them. Most people recover, thank God, but some people don't. So they're used for just that routine schedule of immunization for both adults and children. That schedule I showed you in one of the first slides. They are to prevent specific illnesses from attacking somebody who has to go to a disease endemic area. So cholera, yellow fever, we don't see these illnesses anymore in this country. But they do have them in other countries. And if someone has to go for business or for a mission trip, many times they recommend getting these biologic agents to prevent the risks of these illnesses. People at high risk for certain illnesses, for example, the flu vaccine for healthcare workers and the elderly, that's pushed every year. The various vaccinations given to military personnel. I mean, you get ganged up on and pretty much get injected for everything out there. And then food handlers in certain situations are recommended to have particular vaccines. Injections of antigens can also be used to screen for disease exposure. So an example of that would be the TB test, purified protein derivative, or the PPD, where they take a portion of the outer coat of the bacteria that causes tuberculosis. It's treated, it's purified. That little protein segment is injected under the skin. And if you have previously been exposed to tuberculosis, that site where it's injected will react. There will be a severe inflammatory response, a big old wheal raised, usually 10 millimeters or more across, and that tells you, you got to check this out further. Doesn't say for sure you have TB, but it says you have been exposed either by inhaling the bacilli or having an immunization for TB, which is not given in the United States, but is given in other countries routinely. And last but not least, these meds can modify the disease process in somebody who was not immunized or did not get an illness, like the lady I talked about earlier who had never had chickenpox, was exposed to it in pregnancy, and got the immune globulin to suppress that varicella illness at the time she was exposed to it. Now, people worry about the adverse reactions of these vaccines. That's what parents' big worry is. And they can sometimes happen. Nobody ever claimed that vaccinations were 100% incapable of giving adverse reactions. Anything, any medication you take into your body can give a side effect or an adverse reaction. However, we can totally reassure parents that the disease is a lot worse than the side effects or the risks of the disease. Severe adverse reactions are extremely rare. It's over and over again through studies shown to be about 1 in a million for a very severe reaction. And of course, you have to notify your healthcare provider if a reaction is suspected, and they are responsible for reporting suspected adverse reactions. Now, most of the time we get side effects from the vaccines. They're considered to be mild reactions. So you have mild local pain at the site of the injection. You can have some swelling, maybe even a hive, an itchy hive that comes up at the site. A low-grade fever in the 99 to 100 range is considered normal as you're revving up the immune system and the immune system is responding. Localized rash or itching just around that site or around the area of the site. So what's recommended is that you can use acetaminophen, Tylenol, cool or warm compress depending on what the child is complaining of. If they have a hot, hard, reddened area, a nice cool compress feels good. If they just have a really sore arm, a warm compress sometimes will relieve that. And antihistamines, such as a Benadryl, if there's some itching. It's also beneficial to rest after somebody has had vaccines. Your immune system is revving up. It is responding to that foreign protein, and it always helps to rest, eat right, drink plenty of fluids. I always used my annual flu shot as a chance to just be a complete lazy slug for a couple of days. It's like, I'm resting, I had my flu shot, I am trying to benefit my immune system, don't bother me. Now, what doctors want to be notified of is the very occasional adverse effect. High fever, considered to be 101 or greater, altered level of consciousness, a headache that's unrelieved by Tylenol, lethargy, there's just no energy, and malaise, widespread rash all over the body, urticaria or hives everywhere, an area of vesiculation where the site blisters or forms a really bad looking sore, diarrhea that lasts more than just a day, an increased respiratory rate, complaints of joint pain, difficulty breathing, enlarged lymph nodes. These are still things that usually will go away within a day or so, but they indicate maybe a slightly more severe adverse reaction. Most of the mild side effects come from stimulation of the immune system in response to that foreign protein. And usually you're going to get a headache, fatigue, muscle aches, and just, drink plenty of fluids, eat right, take it easy on yourself for a day or so. The drug interactions can really vary. Steroids, anything that suppresses the immune system, usually is recommended not to be combined with injections. That's the big interaction that can happen. But you want to do a general health history. You want to check the person's original immunization status. If they don't know, blood can be drawn for titers, and that's the most accurate way to tell if a person has immunity to an illness. If somebody has a true egg allergy, like anaphylactic reaction to eggs or the feathers, it's recommended to avoid certain vaccines that are grown in chicken embryos. You can get a flu vaccine that is not grown in a chicken embryo, and then there's no risk of maybe being exposed to a foreign protein. If the person has an infection, if they're an adult, many times they will be sent home and told to come back later. It can vary with a child. If they're already taking immunosuppressants like steroids, and then pregnancy, the woman and her OB need to discuss certain vaccines that may be needed in pregnancy. Some people have an allergy to a certain vaccine itself. An anaphylactic reaction can happen just the way it can to any other med. And generally, the doctor will then either not give the vaccine later or will give it separately, accompanied by Benadryl and watchful waiting to see how the person does. Generally, it's recommended to avoid giving an immunization to someone with an active infection, but sometimes it's necessary for pediatric patients. And why do you think that would be? Think of that for a minute. Well, I'll tell you, since I'm lecturing to nobody. Children do not have the option of hopping in their car a few days later when they feel better and coming back to the doctor's office the way adults do. Sometimes the only time a doctor will see a child is when the parent takes it for some kind of a routine illness. So as long as they don't have a really high fever or a severe infection, many times they will go ahead and vaccinate them anyway. And this is discussed on the website of the American Academy of Pediatrics, the school of thought on these kind of vaccines being given to children with minor illnesses.